I am now delighted to introduce Babatunde Olatinwo, who was voted by a majority of his peers to be the student speaker for the senior recognition ceremony. Fondly referred to as Tunde, Tunde is a Nigerian native whose name means return of the father, as he was the first male in his family born after his grandfather's passing. Also of significance is Tunde returned to New England from England to pursue his nursing degree. Upon graduation, Tunde will begin his nursing career working as a pre and post op nurse. At this time, it is my pleasure to introduce Babatunde Olatinwo, 2021 student speaker.
Hello everyone, Tunde here. Congratulations to all of us. Wow, we did it, we made it. I'm so happy and I'm so glad for all of us. In the toughest year, in a very tough program, we really did it. We accomplished a lot. We know when the year started and they said it was gonna be the year of the nurse. Who could have predicted this, right? I was thinking in my head, I was gonna be going to conventions, grabbing free coffee, grabbing t-shirts, learning so much, around the country, when it comes to this stuff. But in a way, it has been the year of the nurse in more ways than one. Actually, you have to turn on the news, you look at the newspapers, you look at online, you look on Twitter, you look everywhere. It has been the year of the nurse. The nurses are the one carrying the nation, and not just the nation, and the world in general. And congratulations to all of us, because I know every single one of us has been impacted by the current state of the world. We all know someone that has been affected by this current pandemic, and we've all worked in hospitals during this pandemic. So for that, I just want to say I'm grateful to be a part of this group of people, part of this profession. It's I wouldn't want to be anywhere else. I'm stuttering right now because I'm very overwhelmed by the moment, because I'm so flattered and grateful that you guys would think I can give this speech and you would nominate me. So whenever I was thinking about what to talk about, I was struggling a little bit because I couldn't really figure out. There's a lot going on this year. I couldn't really figure out what to talk about. But I thought the best thing to do is talk about my experience this year and some of the things that I've learned this year. When the year started, we all started with resolutions and things we want to accomplish. But obviously, those plans have had a wrench thrown in them. But in the same breath, none of us is going into 2021 as the same person that came into 2020. We've all learned something. We've all, been impacted, like I said previously, by this pandemic and by the current state of the world. So I want us to take the lessons that we learned from 2020, be it in our personal life, our professional life. Let's take all that into 2021, into our actual career, into our actual practice, and use that as a driving force, to be the change, like they always say, that we wish to see in the world. I think part of giving a speech is choosing the right words. And me personally, I know I'm not always good with words, but it's important, like we know in nursing, to use therapeutic communication whenever we're talking to our patients, whenever we're talking to anybody, family members. It's also important that we use therapeutic communication when we're talking to ourselves. It's important to choose the right words, use the right affirmations whenever we're talking to ourselves, because it's been a tough year, and we as nurses, we're very empathetic, and we tend to beat ourselves up when things don't go the way we think they should go. So I think it's important to talk to ourselves like someone we care about, like someone we love. When I think of words, I think, when a president or a politician gives a speech, the speech has such power that those words can either, build the world up or tear the world apart. So same thing with us. When we talk to other people, I know I'm not, like I said before, I'm not very good with words, but when we talk to other people, we should make sure the words that we're choosing are gonna build people up and not tear them down. They're gonna cause healing and not injury to other people. When we choose words, make sure we sit down and think about the right words to choose. In nursing as a profession, us as nurses, we don't get to choose our patient's diagnosis. We don't get to choose their lab results. We don't get to choose a lot of things, that go on. But what we do get to choose is the words that we use in delivering that message and delivering that news to the patient and the family, to make sure we're not causing more damage or more, emotional damage or emotional injury than we're supposed to. So I just want to emphasize that we should, this year, what I've learned is the power of words and how much words matter, the word choice. So we can convey the message in a way that we want to that we meant to convey that message. So with that being said, no man is an island. This program, I couldn't have gone through it without the help of my friends. I get by with a little help from my friends. So I just want to say thank you to a few people. My friend Kim, I just want to say thank you so much. Joy, thank you for always reaching out. My friend Crystal, always reaching out as well. My friend Aubrey, always reaching out, and my friend Andrea. I just want to say thank you to all of you. And as we all go forward, congratulations again to all of us. I hope we all pass our NCLEX, we all get the job in our dream field, and overall, just I hope we all make it through this year and take the lessons that we learned and apply to our future practices. Thank you.